what I need to emphasize is that all those who shake, all those who have slowness are not Parkinson's disease. And it is very important to recognize this. So what are the other type of Parkinsonian disorders also called atypical Parkinsonism? And these are different from Parkinson's disease, and they can have early falls. So in a classical Parkinson's disease, you do not have fall very early. After a few years, they develop fall. But these patients of Parkinsonism, like a patient like what is known as a progressive supranuclear palsy, they will have early fall, difficult to look up and down. When he gets up, he has a tendency to fall backwards. And so this is a classical example of a atypical Parkinsonism, and these patients may not respond very good to levodopa. Then there is another type of atypical Parkinsonism known as a multiple system atrophy. So here also they can have Parkinsonism, but these patients in addition can have difficulty in walking, what is known as ataxia, imbalance, and also what is known as autonomic dysfunction. So there can be significant fall in blood pressure when standing, known as orthostatic hypotension. There can be early urine problem. So they are the patients who, they may not have a good response to levodopa, but we need to detect them early. And sometimes these patients can worsen, their blood pressure, etc., can worsen. There can be very much reduction in the blood pressure on standing. So these patients sometimes may benefit after stopping the medicines. So a movement disorder specialist or a neurologist need to see the patient properly to find out whether really this is a Parkinson's disease or a progressive supranuclear palsy or a multiple system atrophy. Now, there are also Parkinsonian disorders related to excessive, too many strokes in the brain, small strokes in the brain, what is known as vascular Parkinsonism, or there is an entity called normal pressure hydrocephalus, where your brain ventricles or the brain spaces get too much filled with water. So these are also needs to be detected early, and the treatment is different than classical Parkinson's disease. So let me show you a patient of progressive supranuclear palsy. You observe this eye. See, he has a staring look. You can have a facial expressionless face, and he is unable to look up and down. I am telling him to look up or look down. This never happens in Parkinson's disease. He can get up properly very fast. So this is also, but walking is almost normal. But you see, very early he will develop a tendency to fall, which is the doctor is doing a pull test, that is pulling the person, and you see there is no control. So these patients, though may respond little to levodopa, but the treatment is not satisfactory. And these are diagnosed by neurologists, as well as some imaging is needed to diagnose these patients.